Hello friends, I am Dr. Rajiv Mehta, Consultant Psychiatrist, Sir Gangaram Hospital, New Delhi. Bipolar disorder is a type of mood disorder according to the ICD-10 classification and DSM-5 classification. That is basically a combination of two things, depression and mania, or more than two episodes of mania. Depression is a collection of signs and symptoms which include low mood, sad mood, irritable mood, lack of energy, lack of interest in the previously pleasurable activities. That doesn't mean total lack, but decrease in interest in previously pleasurable activities, lack of confidence, guilt, feeling of worthlessness, hopelessness, crying, death wishes, lack of libido. This all collection forms a depression. And bipolar disorder is basically, there are two poles of the mood. One is depression, the other pole is mania. Mania is exactly opposite of depression. That when two combine, then we form the diagnosis of bipolar disorder. So depression is one part, bipolar is a bigger part. The symptoms of mania are exactly opposite of the depression. The manic symptoms means there are high energy levels, high mood, authoritativeness, increased sociability, increased donation, increased energy levels, increased self-confidence, increased energy levels. So all these things form the basis of mania. So when there are multiple episodes of mania, or there is one episode of depression and one episode of mania, then we form a diagnosis of bipolar disorder. Bipolar disorder is generally diagnosed on the basis of history. The history is taken from the patient as well as the patient's relative. A chronological history from childhood has to be taken and seen whether there have been episodes of depression and mania. When bipolar disorder is diagnosed, that means there are more than one episode of mania, or there is one episode of depression and one episode of mania. So bipolar disorder requires at least two episodes of mood, which should include one episode of mania to be diagnosed. Treatment of depression is antidepressants, and treatment of bipolar disorder is mood stabilizer. The difference is the antidepressants elevate the mood from depression to normal level, while in bipolar disorder we require something which is called mood stabilizer. The mood stabilizers bring down the high phase to normal level and brings down the low phase to uppish and a normal level. So these things are called mood stabilizers. We have various mood stabilizers with us, which include sodium valproate, divalproex, carbamazepine, oxcarbazepine, lithium, lamotrigine, topiramate. These are the mainstay of treatment of bipolar disorder, and we can sometimes use antidepressants and antipsychotics also in the treatment of bipolar disorder. Sometimes we have to use ECTs, and admission also can be done for its treatment. Apart from the pharmacological therapy, sometimes the counseling, especially the counseling of the family members, is also helpful in treating the bipolar disorder to prevent the relapse of further episodes. Like there has been an entity called expressed emotions. If the expressed emotions are controlled by the family members, then there is a very high chances that we use minimum of the drugs to treat the bipolar disorder and prevent the relapse of further episodes of bipolar disorder. Simultaneously, for the patient, it is advisable not to be too much impatient for completing their ambitions, and don't keep too much of the things in their heart. Just ventilate them out, and this will prevent the further relapse of the illness.